And welcome to this edition of ACAP Today for the week of June 29th, 2020. I'm Jason Parent with the Aroostook County Action Program. On our webisode today, we are going to speak with Sharon McDonnell, who is a liaison or point person with Maine CDC and the Department of Health and Human Services on a new program that is being offered across the state that we're calling Quarantine Social Supports. She'll be joined by Jamie Chandler, ACAP's COO, who will be speaking with us about how ACAP is working in partnership with Maine CDC and the Department of Health and Human Services to do that work right here in Aroostook County. But before we get to that, we are going to share with you, as we always do, news and information that you can use to help get through this pandemic. And first of all, as we have in recent weeks, we wanted to be certain to share with you the community action promise. We understand and we are with the Black Lives Matter movement in terms of all that is happening in our country, and just share with you this, which is the pledge of community action, that community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So with that, we want to just ensure you that any services that we provide here at the Aroostook County Action Program are done without any discrimination whatsoever, and certainly endorse all of the great work being done across the country by our fellow sister CAPs in that same light. We want to also remind folks that we are offering curbside assistance here at 771 Main Street. In addition to the curbside assistance that we are offering as part of our Phase 3 reopening, we will be allowing in-person appointments to happen by appointment only. So we certainly encourage you to call our office at 764-3721. If you are needing an in-person appointment in our office, we have specific parts of our building that we are allocating for those, and we will do a health screening with you before having you enter into the building, including taking the temperature. But it will be our first opening to members of the public, again by appointment only. But if you feel more comfortable, please do use the curbside assistance that's available. This is referencing our 771 Main Street Presque Isle facility. However, curbside services will also be available at other facilities. We just ask that you call ahead for those services at our other facilities. We also want to remind folks that we do have new navigators in place as part of our Community Service Block Grant CARES funding. We are offering navigation services, especially for individuals who are impacted by COVID-19 at this time, who may not otherwise know what services are available out there for them. So please do not hesitate to reach out and access our navigators. They're very helpful resources at this time. We also are offering at this time information on understanding health insurance options. We know that many individuals, their employment has been impacted and therefore their health insurance. We do have a health insurance marketplace navigator here at the agency, Stan Targonski, who we spoke with a couple of weeks ago, who is available to you by phone. There's also one of the webinars that remains. There was one earlier this past week, and there's one this week, July 1st, Understanding Your Health Insurance Options, that is being offered by our partners there. The information can be found by contacting us. The link is on this screen. Unfortunately, you can't touch that in a video format, but please do reach out to us, and we will be happy to connect you with the July 1st Health Insurance Options webinar. We are also reminding folks that the COVID-19 rental assistance program offered in partnership with Maine Housing that was extended through the month of June is available until obviously July kicks off on July 1st. And we are working with both Maine Housing and the Department of Economic and Community Development about an extension of this program, or a new rental assistance program that will go into effect at some point in July to help individuals who are looking to pay rent for the month of July. And we will get further information to you as soon as we have it available. Hopefully on next week's program, we'll have that new information for you. The Home Energy Assistance Program, like the Rental Assistance Program, is also winding down, if you will. The current season goes through the 15th of July, and we'll have a period of time for just a little over a month before we'll start taking applications for the new season. If you have not applied yet in the heating season 2019-2020, the income eligibility guidelines have increased, and we encourage you to reach out to us. Now is the perfect time. We can certainly get you in before that July 15th season close close deadline, and we would love to sit down with you and talk about that. Those applications can be done completely over the phone and by getting documents to our location either through the mail or through our curbside assistance, or through scanning them and getting them to us electronically by other means. The Head Start program is still taking applications for our fall 2020 season. We encourage you to call us directly for that at 768-3045 with programs in Fort Kent, Caribou, Presque Isle, and Holton. We have a program near you, or we also have the availability to have a conversation with us about Head Start home visiting program, which may be an option for your family, especially if you do not live nearby one of those communities I just noted where we have centers. Workforce development here at ACAP continues to offer workshops throughout Aroostook County via Zoom, or anywhere in the world actually if you'd like to access them. They are held at 1 p.m. on the consecutive Thursdays. There was one last week called Career Decision Making. This week there's a job search one on July 2nd, and then there's resume writing tips on the 9th, interviewing tips on the 16th, and again, all workshops are held through Zoom at 1 p.m. in the afternoon on those respective dates. Please contact Kathy Williams for more information. Her information is right there on the screen. We also have a tobacco cessation program at this time. We know a lot of folks are looking to try to be more healthy. And we certainly encourage you, if you have been considering quitting tobacco and would like a supportive environment in which to do it. Elaine Sipe, who is leading this program for us, is wonderful with it. And she also is available to meet with you via Zoom, so you don't have to meet in person. And she can also help set up groups, support groups for quitting as well. So please do reach out if that is a service that you need. Another available resource to you is this one that we wanted to make you aware of. It's the SNAP, the additional program for schools, the pandemic EBT, I should say, PEBT program, which allows families with school-age children who that do not receive SNAP or TANF benefits are encouraged to call the Department of Health and Human Services to see if they might qualify for this program. This will provide up to $363 per eligible child to assist with the cost of food, which is especially meaningful as some of our food service programs have had a gap in service between their regular school year and their summer food services. So if you do want more information on this, the 800 number on your screen and contacting DHHS is the resource for that. We also want to let folks know that after a couple of months of great service, our wellness shelter for individuals experiencing homelessness, the team there has done such a fantastic job rehousing individuals at that shelter that we are closing that shelter this week on the 30th of June. We are working currently to relocate the services that we were previously offering before this center opened up, the Hope and Prosperity Resource Center. Those services will open up at a new facility that we will announce shortly, likely in the month of August. They'll open back up to the public. In the meantime, those services will be offered by our coaching staff remotely. So if you know someone who is experiencing homelessness or housing insecurity, please do contact our main office here and we will connect them with a coach and make them aware of where these services will be moving, the day service component of that moving forward. A special thank you to our partners at the University of Maine at Presque Isle, Maine Housing, and some other community partners who have led to this shelter being a reality over the past few months for those who need it. We've served nearly 20 individuals through this shelter and have done great work. Our team has just done some fantastic things there. So thank you to all involved in this project. And we also want to remind folks that some of our prevention programs are still trying to be active and keep you active during this time. This past week, we offered a very successful free yoga class for kids and parents at Mantle Lake Park. There will be another one offered on Tuesday of this week, June 30th. And we practice all CDC guidelines. Participants will be screened, 6 foot social distancing is observed, hand sanitizer is available, and equipment is thoroughly cleaned after each use. We have both a K-5 session and a parent-toddler session, and should there need to be a rain date, that will be held on the 2nd of July this coming week. And we thank our partners. It's an ACAP 5210 Let's Go program initiative in partnership with Northern Light A.R. Gould Hospital and the Presque Isle Recreation and Parks Department. And lastly, in today's news you can use, it's actually news that we hope we can use, and that's your voices in our community assessment. We encourage you to take our community assessment, go online on our website, and you can find the link there. You can also find it on our Facebook page. Please do help us get the information that we need to better serve our community in the coming few years. These are required assessments that we do in community action every 3 years, and we are looking to find out what our community needs so we can best meet those needs in future years and develop our strategic plan accordingly. So please do take a moment to complete the ACAP Community Needs Assessment. If you need a paper copy, we have those available, so give us a call and we'll mail one out to you. And anyway, thank you so much for listening to all that information. It's now my pleasure to welcome to the program from the person who works both, I guess, with CDC and the Department of Health and Human Services as a point person between them, and with the community action agencies across Maine and many other organizations who are helping provide what we're calling quarantine social supports. Sharon McDonnell, welcome to the program.
Thank you. It's wonderful to talk to you. And I actually really enjoyed the front piece here. You all are doing some impressive work, and thank you.
Thank you, Sharon. Appreciate that. We have great team members across Aroostook County. One of those joining us from her home today where she's working is Jamie Chandler, who is ACAP's Chief Operations Officer. Jamie, welcome back to ACAP Today. You've been a frequent guest and happy to have you back.
Yes, thank you, Jason. I'm happy to be here.
Great. So with that, I would like to just start out with you, Sharon, because this concept that we're calling anyway, quarantine social support services, is a new one to members of our community. And we've been trying to sort of share, get the word out. And we actually had the opportunity this week to actually work on our first support in this regard, but just get everybody grounded on what this program is all about and what folks are doing to help across the state.
Sure. Well, it should be new to anybody that lives in Aroostook County because it's pretty new to anybody in the United States and the world. And, you know, I had the unfortunate and fortunate experience of working on the Ebola outbreak in West Africa for 2 years in 2014 to 2016. And that helped me get a sense of what it takes to sort of really try to address an epidemic that is, you know, has a huge impact on society. And that helped me get an image of some of this. So the program that we've planned really has to do with linking the public health support of contact tracing and case investigation and testing with what is the support that someone needs to stay in isolation or quarantine, and what do community agencies and communities need to be doing to make sure that they're ready if there are a lot of people impacted, and there have been, even if it's only economically. But their health systems have changed. Much in their normal lives has changed, where they're working, if they're working. And so addressing that at a community level, as well as helping people at an individual level know, well, if I need to stay home, what do I do? You know, if I, you know, what about? And the very notion of sort of being asked to stay home for either isolation, which has to do with people that are actually infected, or quarantine for people who are contacts of people that are infected, is a big one. That's, you know, anywhere from some number of days that they're being asked to stay apart and not go out. And so the kinds of things that are important, it's stressful for anybody. And the kinds of things that we want to be sure that all of the agencies that are kind of offering this, and I will just make it a sideline to say that the state chose 10 CAP agencies geographically distributed across the state, as well as Catholic Charities and the Wabanaki Public Health, to go through and help us make sure that geographically across Maine, that all communities had these core services available. And I'll just describe some of these based on the experience in other parts of the world about what it would require to stay home. So the first is just, it's a big stressor to be asked to stay home. The psychosocial care includes health workers that are working in a completely different situation, wearing PPE, trying to figure out your own contacts with your family, and then to communities about dealing with uncertainty and individuals dealing with the stress of trying to figure out their own way across this, within this epidemic. So psychosocial care may be something simple like warm lines that are being called, to community messaging, chaplain services, Maine Response. So we are asking to be sure that that is thought of for each community so that people have a way to reach out, that sort of thing. The second is, of course, housing. We want to be sure that people have a safe place that they can quarantine or do isolation, and to prevent the transmission of a virus. And sometimes one member of the family is infected and the others may not have been exposed, and they actually need to separate. And that's a very difficult decision to make. And we want to be sure that if they want to be able to separate, that they can have some place to go. So agencies are looking, Maine Housing is working with the CAP agencies and the state, and the CAP agencies themselves, such as Aroostook, would then have the chance to find some place for somebody to go. And this is certainly pertinent for people who live in more crowded housing or that don't have a secure housing as it is. The income support during isolation and quarantine is really basically trying to figure out if there is income support that people are eligible for and that they need. Sometimes it's just a simple thing like making sure that their boss knows that they are being asked to stay separate and not come to work. And that's a sort of an easy type of thing. The food security and support is perhaps one of the most requested issues, and making sure that culturally appropriate food that meets a person's not only their preferences, but sort of how they eat, and that if, does it need to come cooked? Does it need, just somebody needs a shopping outing for them, or that kind of thing, and working with communities and individuals. So making sure there's food, and that can come a lot of different ways. Sometimes it's gift cards, sometimes it's actual Meals on Wheels. So using the existing programs, and that's why I think you all are in a really good position to know all over your county sort of where that might come in different ways. The health prevention activities and medical referral is an unusual social support mechanism that maybe, I think you all sound like you have a pretty good relationship with your doctors and hospitals, but for some of the social service agencies, trying to say, well, do your constituents, especially those in isolation and quarantine, have a thermometer? Are they under symptom monitoring to find out if they get sick, or are they becoming sicker? Do they need to be taken for testing, and how could that be done? That sort of thing is at this point been a very big issue, particularly as testing, where you can get tested and how that works changes about every week as Maine tries to offer more of that.
Wonderful, Sharon. That was a great description. It does obviously include a number of services. Jamie, let me turn to you and ask you then, what is it that ACAP's role is, and how are we making this work happen across Aroostook County as requests come in?
Yeah, absolutely. So we have our coaches and navigators that are on the ready for any referrals that come in from the Department of Health and Human Services, CDC. And when those referrals come in, our staff will be deployed. We have coaches and navigators that are located throughout Aroostook County. And so the assignment of the case will be assigned to a coach nearest to the community that we've received the referral from. And our staff will they will make contact with the individual who has been asked to isolate or quarantine, and we will identify what those needs are and help to get them connected to the community resources that they need in order to successfully fulfill their quarantine or isolation requirement.
Great. Now, Sharon, you had also provided some additional information to us about some of the things that are included in this, and one of them is transportation, correct?
Yes.
So let's talk about that
Okay.
and some of the materials and items that we're seeing now on our screen.
Okay. The transportation is different in that if you're asked to stay home, one is hoping you're not transporting around a lot. On the other hand, if somebody needs to get to housing, they may need to get to testing, they may need to get to a doctor's appointment, a prenatal appointment, that sort of thing. So safe transportation to get essential services done is been an important part. And then another element to this is to make sure that a person who's asked to be in quarantine, maybe this is a chance for them to get to know social services in their area, the people as well as the agencies. And this might be a time where an assessment can be done, such as by ACAP, to look and say, wow, you're eligible for something else, or there may be a service, or you can help us, that sort of thing, to link them into the existing standing social services. We do want to be sure that besides individual care, people in the communities need to know in simple, plain messages, what do you need to do and how to do it. We all need to kind of be reminded to wear masks, how to kind of stay at a certain distance that makes sense, but to stay connected. And that kind of messaging, it's like Coca-Cola and Pepsi. They don't just tell you and go away. They tell you, and then they tell you again, and then they tell you in a different way, and they talk to many different people in the community. And this kind of messaging is essential at all levels to really help people normalize the kinds of things that we need to do to live in this epidemic for a while. The ethnographic assessment and cultural linkages, it sounds like a lot of words, but what it means in some ways is let's make sure we're listening carefully and we're taking in rumors and thoughts, social media. For example, if people may begin to believe, I won't have any food, or I can't go to the hospital, or various things, and we need to know what those ideas are or concerns so that we can make sure that our risk communication is addressing the actual concerns that are there and that their fears and stressors are dealt with. And then finally, we're really hoping that agencies across the state will partner with each other because there's so much to learn. And Maine does not have a strong system of local public health agencies. And that's kind of why we turn to the ACAP agencies to say, please help us make sure that there is community-based support for communities as well as individuals. And let's make sure that we're now beginning a conversation where we have weekly standing meetings and talk to each other about what we've been doing and what we've been learning.
It sounds like across the board, Sharon, communication is very key to this. I mean, whether it's the communication or trying to take down some of the myths or the miscommunication around it, and obviously clearly communicating what the needs are of an individual who's been asked to quarantine, and then the communication between those partner agencies that need to make that work happen. And obviously that happens both from a statewide perspective, but it's also hyper-localized, I would imagine, because you have to take into account what resources are available in the community and the differentiation of the people that you're trying to serve.
Yeah, and this sort of forum is fabulous. I have been, my community stood up a task force we called the Yarmouth Community Coronavirus Task Force, and we've learned a lot from that. And one of our key messages are really working with business communities as they change their relationship with their customers about masking and how they're open and stresses to employees. So there's a variety of kind of messages that, you know, will continuously need, and, you know, they don't seem like obvious maybe recipients of social services, but that's a very big point. And there are lots of sort of partners that we can work with.
Jamie, the work that we're doing, we talked about the navigators that are doing that work. Connecting folks, as we just talked about, is very much about resources that are available in local communities. And I think one of the successes we're having with our navigators and coaches is that they're close to the ground in terms of by region in Aroostook County, because it is a big piece of geography, obviously. How is that a key part of the success of the work we're hoping to do? Because we've only had, like I said, one, to my knowledge at this point, a request. And hopefully, I mean, obviously, God willing, fewer the requests, hopefully it's because of the lower transmission. And I think we all hope that, but I talk about that and the importance of that key factor of our people knowing our place.
Yeah, absolutely. So in order for us to provide the best coordination of care for the residents of Aroostook County, it's really important that the people that are working and helping to make those connections know what those resources are in the community. And so our coaches and navigators, they're members of our community. They're people that live in Fort Kent, Holton, Presque Isle, Caribou, Washburn. They know our communities, they know what resources are available, and they have the contacts made so that they can easily just pick up the phone when someone has a unique need that perhaps there isn't a standard approach to address, and we're able to get that need met pretty quickly.
And we're actually learning things along the way. Like this week, what did we learn this week? That you can actually have an agency come in and do a home test for COVID-19.
Yes, we did not know that prior to this week.
Yes. So we're learning as we go, and I think, Sharon, that's a key and critical part, because I know that you've mentioned a lot here, but a lot of this is patience and understanding, is it not? and requires a strong dose of that.
It really does. A humor goes a long way because all of us are working without a recipe book at every level. You know, your community, your family, the state, and to the extent that we can assume the best, that people mean the best, helps. But I think that a willingness to admit, okay, what don't we know? Every situation, and we've just really been standing up this service for about 2 weeks now, and I want to say that some of that has been standing up just as contracts have been in place. Your agency, as well as others, have taken the trust with the state to say, yes, we will begin to provide services. We know the contracts are being put in place. We're starting small with that to just find our way with this, but every case is unique and presents interesting challenges with the situations.
So Sharon, what are we seeing, just as we get closer to wrapping this up? What are we seeing across the state? Is the demand for the quarantine social support services, as we're calling them, matching the areas where there are obviously a higher number of cases, or do you feel that people are going without in other areas? What are you seeing?
It is, I mean, since this is relatively new, people in the Maine CDC, we're working very hard. The contact tracers, the public health nurses, were working very hard. And I hope what they have is a sense of relief that a lot more people have their back. And the more that they sense that, the more likely they are to refer. I would rather they refer with a very low threshold and say, this person, I don't think they really understand. Let me just ask somebody like at ACAP to just give them a call and find out and make sure they're okay. And we only do that with their permission of the person if they're willing to let their name be passed on to a local partner. The really big need in Maine is happening in Lewiston and Portland, in communities that are having to stay at work, communities of color and ethnic background, and they're really hard hit. And the finding ways to make sure that they're kind of trusted partners and their trusted leaders understand, okay, this is in place. We're here to make sure that these services are available so that people can stay at home, that they don't have, you know, punitive elements to it in terms of immigration, any of that kind of thing, and that they're provided discreetly. But, you know, if a whole family is stuck at home, then the whole family needs food. And so we hope that the social services are the carrot to the stick of having to go along with a public health, in an unfamiliar public health regimen that asks a lot of questions and, you know, that is unfamiliar to people.
So Sharon, I guess the last question I want to make sure, how do folks initiate this process? Do they call their local community action agency directly? Where do you start?
Well, the best way, I mean, staying in touch with the local community action program and talking about ideas and making that sort of discussion so that they know what you're worried about. And if you have a concern that you've been exposed, some of this conversation needs to go both ways. The referral for social services starts with the Maine CDC. When they have a positive case that comes back, they then will talk to that person doing a case investigation. And during that conversation, if they feel that somebody might benefit in any number of ways for a referral, they will then will link to the area that makes the most sense for them geographically, and they'll get a call within you know, a day at the most, usually shorter than that, making a relationship, starting a conversation and finding out. And that initial conversation with the Maine CDC is to find out how might you have been exposed to COVID, who else might have been exposed when you didn't even know that you were transmitting the virus, you know, things about your living situation, but it does not go into detail. And so we feel like their goal is to find out more about viral transmission. And our goal is to make sure that people feel safe and supported and can work with the public health program. And so they will be referred by Maine CDC. Now, sometimes in that initial conversation, that may not be clear. So they can ask the ACAP program and the ACAP here, or the CAP programs in other parts of the states, have in some cases, or local agencies reached out to us to say, you know, here's somebody that I think needs some support. And then I will make sure that they are, in fact, we'll connect them with the system and make a referral that way. So it's not just one way.
Great. So Jamie, any last thoughts from you in terms of wanting community members out there to know that we are here for them through this and to not hesitate to reach out?
Yeah, absolutely. We are certainly here, and as Sharon indicated, we'll be receiving referrals from the Department of Health and Human Services CDC. If you have any questions or concerns, please don't hesitate to give us a call, and we are happy to help facilitate and get you connected as we need to. Also, just a reminder to our community partners. I think I said this the last time I was here, but thank you all to the community partners, because we cannot do this by ourselves. And so we may be reaching out to you soon if we do have a case in your area to help us support so that someone is able to comply with their quarantine or isolation. So again, thank you to our community partners as well.
We certainly put one of them to the test this week, the test being the literal case there, and they're helping us with the testing. So yes, indeed, that is true, Jamie. So great. We couldn't do it without our community partners, and certainly couldn't do it without the support that we're receiving from you, Sharon, and the folks at DHHS and CDC. So thank you for all you're doing.
Thank you.
All right, and with that, before we leave you today, just want to remind you, as we do every day, that you are not alone. And one of the ways that we want to ensure that's the case for you is to invite you to reach out to us, whether you feel that you might be in need of the services we just talked about. You can give us a call, or any of the services we talked about at the beginning of the program, or anything that you might be challenged with in terms of a need. We can certainly help navigate you to where we need to go. So do call us, email us at acap-info@acap-me.org. Connect with us on Facebook. Look for our YouTube channel, where you can see past broadcasts of ACAP Today, but also some wonderful things that have been prepared, some wonderful videos that have been prepared by our early care and education professionals and our prevention professionals as well, that are some lessons that you can show to your kids right in the comfort of their own living room. Also check out our website at acap-me.org. And we leave you today, as we do each week, with our snapshot of the week. This is Jessie Pettingill, who is one of our wonderful team members in prevention, one of our leads in prevention. And they were holding a training earlier this week at the Mantle Lake Pavilion, appropriately social distancing, enjoying some great weather, and getting some great information on how they can better serve residents of Aroostook County through our prevention programs. So we thank them. And we thank all of you for joining us on ACAP Today for this week. We'll be back next week with another edition. In the meantime, stay in touch with us through social media and in other ways. We look forward to seeing you again soon. Have a great week, everyone.